do it in the healthiest way possible. So I chose the field of endocrinology because I knew I would be able to do that. I knew by guiding people through various hormonal issues, specifically diabetes, I would be able to help them prevent many other medical conditions that would have really affected their quality of life later on, like heart disease and kidney disease and even things like blindness. But I'm also a weight loss patient. I have struggled with my weight my entire life, and I actually learned a lot from treating my own patients. And I saw how their weight loss changed their lives for the better because they were preventing other medical problems that were related to weight and obesity. So I started my journey and took my own advice and was able to be successful in my own weight loss efforts. And that has changed my life as well. I'm a much healthier person and I think a much better doctor because of that. And I hope that my patients feel the empathy from me when they are going through the process as well. Not only do they understand that I'm an expert in my field, but they also know that I've been through it as well. I decided to start my medical weight loss program at La Chalet because I knew the quality of aesthetic care that was being provided there. Dr. Espinoza really cares about her patients, and it's not always about the cosmetic side, it's about health and self-confidence. And I knew that that would be a good partnership where I could bring to the table medical weight loss and metabolic health, while also being able to provide my patients with aesthetic direction, because there are a lot of things that happen to one's body when they do lose weight. And I wanted them to be in a practice where that would be done responsibly as well. I am on a mission to provide responsible medical weight loss and metabolic health treatment. There are so many other med spas and even online weight loss programs that aren't as responsible, in my opinion. They do offer weight loss programs, they do offer medication, but it's not always under the guidance of a trained medical professional. It is not always with combined nutritional and physical exercise guidance, and it is not always with FDA-approved medication. And that is something that is very important to me, is to make sure that patients are getting responsible, evidence-based medical weight loss and metabolic health care. The La Chalet Medical Weight Loss Program is a very comprehensive weight loss and metabolic health program. Patients will meet with me for 90 minutes, and I go over their entire history, their medical history, their family history, any medications they're taking, dietary recall to see what type of foods they're eating and what they like. We also do a comprehensive in-body body composition analysis using a bioimpedance scale, and that enables me to see exactly where people carry their fat, their muscle, their bone, their water, and that gives me a pretty accurate representation of their metabolic health. I can find out things including their basal metabolic rate. I can find out things like visceral fat levels that are directly related to medical issues like insulin resistance. And I can also see, while we're treating them, are they maintaining muscle mass? Are they losing muscle mass? I want to be certain that my patients are losing weight in a healthy way, so as that they're not going to develop other unwanted problems related to weight loss that is too rapid or changes in body composition that can actually be detrimental. So I make sure that I'm with patients every step of the way. We do a body composition analysis every month. We review their diet every month. I make sure that they're getting enough protein and fiber and healthy fats in their diet. And I can tell that the patients are doing these things by watching their body composition over time. I have patients in my program that are coming from all walks of life. I have patients that have legitimate obesity and health problems, but I also have patients who have really struggled through different transitions in their life, changes in job, pregnancies, menopausal transition, and I am very happy that I can help them as well. I think patients feel very safe as they go through our medical weight loss program. They feel seen, they feel heard, they feel validated. They know that I'm not going to be telling them that they just need more willpower or to eat less and exercise more. They are truly understanding that they're being treated for a medical condition. These are people who have been healthy their entire lives, and all of a sudden they're struggling for various reasons. By going through this program, many of these patients are able to recapture their younger selves and their health, and they move forward in a more positive way. They have more confidence, they feel better, often their relationships are better, and it's very gratifying to me to see that. Recently, one of my longtime patients approached me and just told me how much I changed her life for the better. And that was so gratifying to me as a doctor and a human being. A lot of my patients are concerned about how they're going to look after they lose weight. There's been a lot of media about things like Ozempic face, and they're worried that they are not going to look good even though they are healthier. One thing that's wonderful about La Chalet is that we're able to synergize the weight loss component while addressing the aesthetic component. So while my patients are in the process of losing weight, we're also introducing them to all of the wonderful aesthetic options that we have at La Chalet. So things like filler and Botox and many of the skin tightening modalities are very helpful to prevent that type of look while they're losing weight. And then once they are through their journey, they're even more confident because they haven't had to watch their faces and parts of their body become something that they're not comfortable with, even though they have lost weight. When I realized that I could treat diabetes by using a holistic approach where I would educate them about diet, I would educate them about physical activity, and be able to use medications that would help them to lose weight, that became my recipe. And as I saw that be very successful, and patients were becoming healthier, I also realized that I was developing this passion for obesity medicine. Obesity medicine and medical weight loss are such exciting fields because there are so many wonderful treatments coming down the pipeline. We already have amazing weight loss medications like Wegovy and Zepbound, and they have really changed the face of medical weight loss. And we know that in the next year, there are going to be even stronger and more effective medications that are going to be available to patients, and that's a very exciting thing.